Hello and welcome. Today, we're diving into a rare and intriguing condition affecting the urinary system, bladder malakoplakia. We'll explore its causes, how it develops, what to look for, and how it's managed. Let's begin. The exact cause of bladder malakoplakia remains somewhat elusive, but it's widely understood to be linked to impaired immune function. This impairment typically arises due to underlying conditions such as diabetes mellitus, organ transplantation requiring immunosuppressants, chronic infections like urinary tract infections, or other debilitating illnesses. These conditions weaken the body's ability to effectively fight off bacteria within the bladder, ultimately paving the way for the unique pathological processes that define malakoplakia. Now let's unravel the pathophysiology, or how malakoplakia develops. It all starts with a defect in the macrophages, the body's clean-up cells. These macrophages are unable to effectively digest bacteria, specifically E. coli, within their cells. These undigested bacteria accumulate within the macrophages, leading to the formation of characteristic intracellular inclusions called Michaelis Guttman bodies. These bodies, which stain positively for calcium and iron, are the hallmark of malakoplakia and are crucial for diagnosis. The accumulation of these affected macrophages creates soft, plaque-like lesions in the bladder wall, disrupting its normal function. Bladder malakoplakia is a relatively rare condition. It's most often seen in middle-aged to older adults, and individuals with compromised immune systems are at higher risk. While it can occur in both sexes, it tends to be slightly more prevalent in women. Due to its rarity, precise epidemiological data is limited, but awareness of the risk factors is crucial for timely diagnosis. The symptoms of bladder malakoplakia can vary depending on the extent and location of the lesions. Common symptoms often mimic those of a chronic urinary tract infection, including frequent urination, painful urination, urgency, and blood in the urine. Some individuals may also experience lower abdominal pain or discomfort. Because these symptoms overlap with other more common conditions, diagnosis can sometimes be delayed. Diagnosing bladder malakoplakia requires a high degree of clinical suspicion, especially in patients with predisposing risk factors. The definitive diagnosis is made through cystoscopy, a procedure where a small camera is inserted into the bladder to visualize the bladder lining. Biopsies are then taken from any suspicious lesions. Microscopic examination of these biopsies reveals the characteristic Michaelis Guttman bodies within the macrophages, confirming the diagnosis. Special stains, such as von Cosa and iron stains, are used to highlight these bodies. While not strictly classified into different types, malakoplakia can be localized or diffuse, affecting a small area or the entire bladder lining. The extent of the disease impacts treatment decisions and overall prognosis. Treatment for bladder malakoplakia aims to address the underlying immune deficiency and eradicate any associated infection. Antibiotics are typically prescribed to combat the bacteria involved, usually E. coli. Medications that enhance macrophage function such as ascorbic acid and vitamin C, bethanechol and trimethoprim sulfamethoxazole may also be used. In severe cases or when medical management fails, surgical intervention, such as transurethral resection of the lesions or even partial cystectomy, may be necessary. Addressing the underlying immunosuppression is critical to prevent recurrence. Currently, there are no specific guidelines for preventing bladder malakoplakia beyond managing underlying conditions that predispose individuals to immune dysfunction. Maintaining good hygiene, prompt treatment of urinary tract infections, and optimizing the management of conditions like diabetes can help reduce the risk. The prognosis for bladder malakoplakia depends on the extent of the disease, the patient's overall health, and the effectiveness of treatment. With prompt diagnosis and appropriate management, many individuals experience significant improvement. However, recurrence is possible, especially if the underlying immune dysfunction is not adequately addressed. Recent research focuses on understanding the specific immune defects involved and exploring novel therapies to enhance macrophage function and prevent recurrence.